Hi, everybody. Welcome to another chance to meet and greet with our event speakers. Of course, you know that we're having a wonderful event coming up, a virtual event coming up September 27, 28, 29 for people with lipedema and lymphedema and all their people who help are on their team with caregivers and clinicians and everyone else. And so I'm Leslyn Keith. I'm the Director of Research and President of the Board for Lipedema Project. And I'm here also with a colleague, but also a collaborator and a speaker who is at our event. So welcome, Lisa. It's so good to have you here to chat.
Leslyn, I'm so happy to be here. Thank you for having me. And it's fun to be in the role of being interviewed as a speaker and a collaborator, right? Because I do so much podcasting and live streaming. I'm excited to be your guest.
Yeah. Yes, thank you. And thank you for doing that. Lisa is hugely involved in this event that's coming up in so many different roles. So I don't know how you do it all, Lisa, but she does. One way that she's involved is through her business, RLD. And so that is a collaborator in this, but you're also and I always forget the title, for Lipedema Simplified, you are the managing director. Mm-hmm. So you have that role in our organization, but also for the event itself, you're hosting, you're emceeing, you're part of one of the panels. And also as a person with lipedema yourself, how do you do it all? Because I think that, this is something that happens to a lot of people with lipedema. They can get overwhelmed with all their many roles in life, and then getting things about, all these different things they should be doing for their lipedema. And then you start to feel guilty because you're not doing them all. Yeah. How do you manage all that?
I don't know that I do. I mean, I guess that's the truth, right? I think it's about, I have a phrase that I use in all the burnout prevention workshops that we do with our clients at RLD Group and the lipedema community as well. It's what matters most right now. And I think what matters most right now is a really good lens to figure out, okay, should I be in my pump? Should I be with the vibration plate under my plate? Do I need a nap? And I have done all those things. But when I feel overwhelmed, that is one of my first go-to questions is what matters most right now, because it tends to spiral in my head and my heart is here. I want a cure for this disease. I want people to be empowered with information. I know community is the foundation for all of our healing. And so I think I'm energized by the work that I do every day, whether it's RLD Group, working with organizations for culture transformation or burnout prevention, or working in the lipedema community as an advocate, a facilitator, a podcaster. They all kind of tie back to my true care and mission in life, which is to be of service and also to, bring the invisible to become visible. Right. And there's so much in our disease that is invisible to the world. And it's important to talk about. So I don't do it perfectly, Leslyn. I'm a mom. I'm a business owner. There's days I'm a little snarky and tired, and I just work through it and try really hard to prioritize and triage. And I'm getting better at asking for help. Better at asking for help.
And we get, we're getting so many nice comments here in the chat. And this is one thing that helps. Is that, there's people out there that appreciate you and tell you that they appreciate you, and knowing that none of us are perfect and we're striving to be, to manage it all and to take care of everything. But we're not going to always do everything as we would wish, but people are still there and they still love us. So
yeah. It's like I see Leslie and Becky and Nancy, Marilee, Kristen. I'm so glad you guys are all here as we're talking today. Because it is when we can see each other and hold space for each other, we are more equipped to navigate the world that we're in. And doing it alone is, I think, detrimental to our mental and physical health. I do.
Yeah. And I don't know if Sherry is here today, but she posted something the other day on another Facebook Live that she said, I am overwhelmed and I'm trying to figure out, how do I prioritize? How do I figure out what I should be doing? Because there's so many good options, or at least things that maybe I want to explore, but I don't know where to start. And so you gave one great tip, what is important to me right now, today? What should I go with that? And I think that you have other tips, especially when you talk about your burnout course. And so is there other things that we can share with people that are having trouble prioritizing and figuring out what direction to go?
Yeah, I mean, oh my gosh, I feel like there's a book inside me on this one because
Yes.
there's like so many layers of, I'm going to call it unlearning. Society wants you to always be on, you always feel like it's never good enough. There's job insecurity, there's fat bias, there's, medical systems that take months to get into, and you can just feel like, oh. So wherever people are on that overwhelmed journey, I think one of the things that I found, because I was in your shoes 2.5 years ago, I was overwhelmed, I was angry, and I was lost. And so I think one of the things to do is, for me, it was join the Lipedema Simplified tribe and community so that I could learn from and with each other. So I still go back to don't do it alone. And I also think, Leslyn, one thing I learned from you early on was that it doesn't have to be everything, right? That if you can't get compression right away, perhaps you get in a pool. If you can't get in a pool, maybe you just, get a vibration plate. Like, what is one thing you can do? Not everything, because I was guilty of, looking at the list of all the things and trying to check them all off in a week. And that's set you up for failure. So I think there's that. Breathing. You don't have to pay anybody to breathe, right? You can breathe deeper for your lymphatics every day. And I think for me, it was a turning point for me was being honest with my family about the level of pain I was in. Because for me, I didn't know I was in pain. I was so used to it. But once I started learning from and with you all, and I started to identify, oh, that's why I don't stand so long, or that's why I don't want to go this place, or all of the things that were underneath with anxiety and pain, when I started presencing those in my safe place, which is my family, they were a lot more understanding and more tuned in, right? Because I was just acting like everything was fine, and it wasn't. It wasn't fine. It's still not fine, right? It's finer. Is that a word? Right? There's really hard days, and I think having support system, whatever it is, work, family, friends, where you can be honest, it's game changing because you feel seen. Yeah. So I hope that helps answer the question.
I do think so. I think because you're familiar with that overwhelm and that burnout, and a lot of people, when they actually do your course about burnout, they're not preventing it; they're already in it.
Yes.
And now, how do we cope with that? And I think what your idea is just pick one thing. It may not be the most effective or the best thing, but it's something that is possible to do right now, like breathing or something like that. So yeah. You're just picking something, and to not worry so much about figuring out what are, the top optimal things to do right now. Because there's just so many to choose from. And I do think there's a possibility of this happening at the event that's coming up, because we're going to talk about a whole range of interventions that might be helpful to someone who has lipedema and or lymphedema. So it's going to be easy to become overwhelmed in that. And so I think one of the biggest and most wonderful things that you're going to be doing at the event is that facilitation of people being engaged as much as they want to, interacting as much as they want to. Can you talk a little bit about how you're going to be facilitating that at this weekend's event?
I would love to. And I see Leslie's comment to be here. I was diagnosed last week and I'm excited to learn. Leslie, I just want to say you're not alone. And the fact that you're already posting and talking about it is a beautiful gift to the community. So thank you for bringing your voice in here. Leslie, one of the greatest honors, the gifts that I receive from being a part of this organization of Lipedema Simplified and Lipedema Project is co-hosting and facilitating. And the reason I like it so much is it's what I do in my day job at RLD Group, part of what I do. And I understand and have figured out ways to create space for people to be where they are. And the way that we facilitate this event is like no other. And I'm really proud of that, because we have basically designed it so that wherever you are, if you're lurking or brand new, you don't even want to be on camera, you don't want to talk to people, or you're like, hey, I'm all in, tell me everything. You get to choose your own adventure. And so the way we design it is we give you some reflections before the topic. You think about, okay, if we're talking nutrition or conservative care or surgery or GLPs or anything in between, right? You reflect on the thought on what you want to get out of that topic. The topic then gets taught by an expert or a panel. And then you actually have time to reflect and go into conversation with other patients, caregivers, and clinicians. So those breakout rooms, we call it knowledge activation. That's what happens. And so at Heart to Heart, I also believe it's heart activation, because in those breakouts, people get to explore their ahas, presence their questions so we can get them into the Q&A and connect with each other on a very deep level quickly, because we're talking about our lives. We're not just talking at you. We are talking with you. And when the breakouts are done and we do the report outs, we ask for volunteers. And I'm famous for, in 1, 2, or 3 sentences, what did you want to share from your event or from your moment, right? And I'm so inspired. People name each other, express appreciation for recipes or compression insights or everything in between. And I just feel that people feel more connected with each other and less overwhelmed because of the way this event is designed. I have been to a lot of conferences where you sit still all day and speakers are on stage and they talk at you. This event is about the wisdom inside the system, the attendees, the clinicians, the experts who are there, and bringing all of that forward, because as the premise of Lipedema Simplified and Lipedema Project is that the wisdom's inside this. You are the best person to know what's going on in your body. So we're going to help you investigate, initiate, and design what matters for you. So when you leave, it's not like, well, here's the checklist of everything we need. No. Here's what I know I need to do for me. And I don't want to miss it. I love these events. And I learn too every time.
Yes, that is. And I used to say that the same thing when I was actively involved in treatment of lymphedema and lipedema with my patients. Every single patient brought me something that, oh, I never realized that. That's what I can use now to help other people. So there is an amazing amount of insight and wisdom in the person going through the experience of having the condition that can be transformative for another person who's also having that difficulty. So and when you bring people together and as a larger group, but also in these smaller breakouts, so you're with 3, 4, maybe 8 people at the most. Sometimes a lot more can come out in that smaller group. So it is an incredible event. I think the way that you and Catherine have designed this to be so interactive it's an experience that is not to be missed. People have to come.
I agree. One thing I'll say too is we also offer the quiet room, because sometimes you just need more time to process. And so I say a lot, like, choose your own adventure, show up where you are, do what's right for you. And I think having control and agency over that really helps people realize and learn to advocate for themselves, even in the sessions, right? I'm going to do a quiet room this time, or this time I'll be on camera. And especially when I have my feet up right now under my desk. I've pumped during our events, right? And so I think it's just important that people recognize that they don't have to have a beautiful podcast studio. You can be on your couch, with your laptop on a pillow while your legs are up. And it's okay. Like, come as you are, because this is about you. This is to support you. And I really, really appreciate that we have the premium registration status too, Leslyn, because as much as you learn everything you need to know that day, digesting it all, processing it, getting back to it. Maybe you want to take a lunch break and you miss a session, or you want to have a smaller access to the speakers during the premium Q&A. I'm really grateful that's there for people, because yesterday I was watching what we did in April. I watched my replay again just to remind myself, oh yeah, okay. I just think that the premium opportunity for people, it's really helpful. And I would think for clinicians, as we're inviting our clinicians, right? Maybe they're working all day Friday, or someone with a full-time job is working on Friday. Do you see that for the clinicians as well as a perk, or like a huge benefit?
Absolutely. And for this event, particularly this time, I've been doing a big push to encourage clinicians to attend, because I realize that there's a lot of old information out there about what should be the intervention for lipedema, and it's kind of limited. And I think that more options are seen for lymphedema. And we have, we're talking about both conditions. And I think that there's a lot more out now for interventions for lipedema, and the clinicians aren't aware of it. And so this is a huge topic that's going to be talked about at this event. We're going to be talking about what the clinician can do to help their patients. And so I really want them to come, but I realize that most people are working on Friday. Typical work schedules are Friday work, and you're thinking, well, I'm going to miss the whole first day. Well, not if you get that premium upgrade. To have that, you will have the replays for anything that you missed, or you already have something planned for Saturday afternoon or Sunday morning. You're covered with that premium, so you'll be able to do the replays. So I really encourage everybody to get that link below, learn more about the event, register, and even if you're not available, get the premium upgrade, because maybe you are available for some of the time, and the rest of the time you can watch that replay. It's hugely important. I want everybody to be involved in this discussion and be part of the solution, instead of trying to muddle on by yourself.
Oh, I did my first heart-to-heart with my CLT, and she was actually, I brought my laptop and we played part of it because I had my manual lymphatic drainage scheduled and I wasn't going to miss it. And she was like, I've never seen anything like this. How do you get all this information in like these 3 days? And then she ended up sponsoring one. She was so moved and inspired, right? Yes. She actually did some of the Dr. Perrin stuff. So yes. One of the things I know is that our CLTs really want to help us.
Yes.
And they don't know about this stuff. They don't know what's changed because they're busy treating everybody every day. Mm-hmm, mm-hmm. And I also think that that's true for my doctor. I mean, I sent an email to everyone in my medical portal. This event's happening. This is why it's important. I'd like you to join with me. Mm-hmm. And that ended up me getting an invitation to the functional capacity exam, occupational therapy team to talk about it, which I'm doing. I'm recording that today. And so I think even just opening the door to your care providers and letting them know that this exists can help them help you. And I love, Leslyn, that you're just bringing that to the forefront, because we all know that the medical system needs more information and we're providing it. But if patients invite you, I mean, it's almost like an honor that you even thought enough about me to invite me to this experience. So
yes.
Yeah, I'm really glad that we have this available to them.
And I did also see another person put a chat in here that she really would like to come this weekend, but she can't afford it right now. So please contact us. You have Lisa's email, lisa@lipedema-simplified.org. I'm at Leslyn@lipedemaproject.org. We're going to see how we can help. So in past events, we've had scholarships available to help reduce the cost for you. So please contact us. We don't want you to miss this opportunity because of finances. So please let us know, and we're going to see how we can help. And we got someone, Donna, listening from Arizona. That's wonderful. Thank you for being here. Becky said that she's in the same boat as Nancy about worrying about finances. Please contact us. And we'll help you. This is, like I was saying before, it's so important for us all to be involved in this conversation and work together to find a solution. Lisa, you were saying that your ultimate goal is, let's find a cure.
Yeah. When I first started and I found out people have known about lipedema since the 40s, I was really mad. And I decided I can either be mad or I can take action. And I mean, listen, I'm in the pool at the gym and I can tell what's going on. And so, I make small talk conversation with ladies in the pool, and they're like, what are you doing here? I'm like, well, I've got lipedema, which turned into lymphedema as well. And this really helps my body. And that's all it took to open up a conversation. And they had never heard of it. I got a text the other day from a woman because I left her a note. She asked me for contact information and she texted me and said, it all makes sense now. Thank you for telling me. And I feel like we can all be a part of this movement, which is sharing our lived experience, not diagnosing others, sharing our lived experience, inviting people into these conversations, because that is what's going to move the needle. And all the research that you are all doing at Lipedema Project, being able to represent us in Potsdam with, the cutting edge at that World Congress last year, I'm confident that we can figure this out. We are smart. We are wise. We are informed in our own bodies. And now it requires us to come together to share our insights and to move that needle. Because I think it's possible. I really believe it's possible.
As our medical advisor, Dr. Matthew Carmody, says, that the wisdom is within the patient. It's within you who has that lived experience of this condition. And by coming to these types of events and sharing what your own experience is, and then being able to collaborate with others, you are being part of the solution. You're taking action. And I know that helps a lot of people when they're trying to deal with all of the aspects of having this condition. It's wearing on you psychologically, emotionally, socially. And that's why we're so focused on helping and working with the whole person, not just, well, let's go do manual lymph drainage. Let's do some exercise in the pool. We need to deal with the whole person. You are not just your disease or your condition. You are a person.
You are a person.
Yes.
Yeah. If I could say one thing on this, I really thought in the beginning when I figured this out, I was going to run to surgery and just have this disease removed. And I did everything I could in my power to get my functional capacity exam, tell my doctor what I needed, get referred to a CLT. And then I went to a heart-to-heart and I realized how much more there is to this, how much more complexity there is, and that this didn't happen to me overnight. This has been since puberty, and it's evolved with my life with pregnancy, IVF, menopause, right? And so one of the things I just want to highlight for people is that slow and steady wins the race. Curiosity is where it's at. And, I'm finally at the point where I'm pursuing surgery 2.5 years later, Leslyn, and I feel much more equipped. I feel more mentally ready. My body is in a much better place. I know what questions to ask. I've done a lot of experimentation on my own with nutrition and all of the different modalities. And I feel like I don't know anywhere else in 3 days you can learn all of that to be able to then decide your next step. You can Google things and you can follow people on Instagram for sure, right? It's out there, but this is actually designed with building the foundation in mind so that you and your body in this journey with your heart and mind along for the ride, walk away with a plan for yourself. And I don't know where else you get that. I haven't seen it anywhere else but here. And I'm just so honored to be a part of this.
Yeah. I totally agree. And just to make sure people know that, surgery can be part of the equation. It's one of the many things out there that may help in your particular situation. And so that is part of what we'll be talking about this weekend. And matter of fact, we're launching a special program to help people, guide them through that surgery process, from pre-surgery for all the stuff you do to prepare for it, as well as post-surgery. And many of those things are part of the conservative care and having a community and all those things. It's a full package. It's a wide range of things that you would choose to do. So join us, be here with us for this weekend, September 27, 28, 29, virtually from your living room or on your cell phone as you're out at an appointment. Join us and be here and be part of that discussion. We certainly would love to see you. And contact Lisa and I by email if you have any difficulty with signing up and registering. We want to help. So we look forward to seeing everybody. Any final words, Lisa, before we sign off today?
I think my final word is don't do lipedema alone.
That's it.
Don't do lipedema alone. Join us. I can't wait to see you in a breakout and see your smiling faces. And if you need any help, let us know. But don't do lipedema alone. It's been lonely enough this whole time. You don't need to do this alone. We're here. Yeah. Thank you, Leslyn.
Excellent. This has been wonderful. And we'll hopefully see everybody there. Bye-bye, everybody.
Bye, everyone. Make it a great day. Thank you. Donna's going to be there. Can't wait. Whoop, whoop.